Assalamu alaikum. This article talk about the bacteria and virulence factor in periapical lesion from endodontically treated and retreated teeth. This done by Bronzato and Gomes in 2021 in Sao Paulo in Brazil. As we know that the persistent infection following root canal treatment may result in non-healing periapical lesion and root canal retreatment being indicated. The bacteria pathogenicity is related to their virulence factor, which are structure, product, or strategy that the bacteria use to infect the host. These virulence factor lipopolysaccharides, which is the part of the outer membrane of gram-negative bacteria, and lipoteichoic acid LTA belong to the cell wall of gram-positive bacteria, are the virulence factor related to the inflammation and the periapical bone resorption. This cross-sectional study aimed to investigate the presence of the 17 bacteria species and to quantify the level of endotoxin, LPS, and LTA present in the periapical lesion associated with the root-filled teeth and those had undergo root canal retreatment. The secondary goal was to associate the microorganism and their virulence factor with the clinical and radiographic feature. According to the methodology, all the sample conducted in the periapical dental skull and all the periapical sample collected by an experienced operator with 20 years experience in endodontic microsurgery, and the patient selected based on their radiographic images, and the patient that required endodontic microsurgery divided into two groups. One group which is went directly to the periapical surgery without having root canal retreatment, and the other group have already root canal retreatment and they need periapical surgery. And the reason that the primary root canal treatment doing surgical retreatment instead of non-surgical treatment due to the presence of the new post and core, and there is a procedure error and apical canal deviation. And we exclude that the cases that have periodontal disease or trauma or fractures or having medication. All the sample collected from periapical area drawing the root intersection, and the clinical radiographic features is recorded. Drawing the microbial analysis, all the DNA from the clinical sample were extracted, and DNA concentration were recorded using DNA quantification machine using the PCR reaction, and LPS were quantified using LAL, which is limulus amebocyte lysate chromogenic test, and lipoteichoic acid quantified using LTA ELISA kit. Regarding the results, that 19 of the total 32 patients that receiving endodontic microsurgery having root canal treatment done once, and 13 having root canal treatment done twice, which is half the cases having retreatment. And the mean ages is 49. 28 out of 32 diagnosed preoperatively as acute or chronic abscess, and 4 of them without abscess and doing the surgery due to the presence of the periapical lesions during the routine examination. The microbial profile, the bacteria DNA was detected in all samples. The microbial samples contain between 1 to 7 bacteria species, and only one sample contained one isolated species, which is E. faecalis. B. micro, which is Peptis streptococcus micros, was the most commonly detected species in all group, followed by E. faecalis, F. niclotam, and P. edentalis. And the number of the root canal treatment done once or twice was not associated with the presence of any specific bacteria species in the periapical lesions, and also there is no association was found between specific bacteria and clinical features. According to the virulence factor, LPS and LTA detected in all samples, and the level of LTA and LPS in periapical lesions of root-filled teeth were not significantly different from retreated, and the level of LTA were significantly different from LBS in a periapical lesion of both treated and retreated, which is mean more gram-positive bacteria than gram-negative bacteria. In periapical lesions of root-filled teeth, which is the root canal treatment done once, the level of LBS were significantly higher when there was tender tuberculation, and the level of LTA were significantly higher when there is a history of previous pain. In a periapical lesion that following root canal retreatment, which is the root canal treatment done twice, the level of LPAs were significantly higher when there was a post-encore, and the level of LTA were significantly higher when there was an improper root filling. The divergence in the literature concerning the bacterial predominance in a periapical lesion might be justified by different sample collection, methodology, and clinical condition of the patient. So in conclusion, with the limited of the sample of the study, a periapical lesion of both root-filled, which is root canal done once or twice, had similar polymicrobial composition, and the level of LBS and LTA in the periapical lesion of root-filled teeth were similar to teeth have been retreated, and they were related to symptomatology. And thank you.